Good afternoon, and today I have a pleasure of interviewing my colleague, Dr. Pamela Maragliano. She's a dentist, but also she's a prosthodontist, and on top of it, she's the editor of Dental Economics, and she's a host of their podcast called Dentistry Unmasked. Good afternoon, Pamela.
Hello, thank you for having me.
Absolutely. And thank you very much to our audience. If you have trouble sleeping or sleep next to snoring partner, we're going to talk about dental sleep medicine and how to make your journey easier. And if you're a medical practitioner who, just like us, trying to put all the puzzles of this difficult field together, we're going to learn the secrets what Dr. Pamela going to share with us how she built dental sleep medicine practice inside of her dental practice or prosthodontic practice. And of course, this podcast is part of the journey for my book, what I'm so passionately writing, and this is one of the experts on my book. So welcome. And I would like to, my first question to you, Dr. Maragliano, and I want you kind of talk about your bio, because I know you had such a dynamic journey. Like you've been on all the levels of our profession, from dental hygiene, become a dentist, and from that to become a prosthodontist. And then you have editorial leadership, and on top of managing your private practice and podcast and all of that. And I want to kind of bring it all here and ask what inspired you to have such a dynamic journey, and on top of it, to bring dental sleep medicine in your practice and how you get started.
Sure. Well, I can tell you none of this was by design. So it's not like I said, oh gosh, you know what I want to do? I want to be in school for as long as I can and figure out how long of a journey I could take it. That's not what happened. My father felt that dental hygiene would be a great profession for myself and my sister. And he said, let's, get that so that you'll never have to depend on a man. That's really what this was about. And so he said, you can do whatever you want after, but you should be a dental hygienist first, because there was a hygiene program at the community college by my house in New York. So I made a deal with him. I wanted to go to become a veterinarian. And I said, if I don't get into dental hygiene school, maybe my don't depend on a man job will be a veterinary technician. And he was like, fine. But I got right into dental hygiene school, which doesn't always happen. So I was very fortunate for that. And I fell in love with it. And so I earned my associates in dental hygiene. And I figured the next step was to get a bachelor's degree. So I moved to Boston and I got my bachelor's degree in dental hygiene. And I started practicing as a hygienist during that time. And I started working for prosthodontists. And I felt, well, if I'm going to be a dentist, I want to be like them. I want to be a prosthodontist like them. So while I did not have a lot of dental experience, I didn't get a lot of encounters with other specialties. It was just sort of like, for me, it was like pros or nothing. So I went into dental school with the full intention of becoming a prosthodontist, because I wanted to be like the doctors that I admired so much. So that's sort of how that all happened. And so I went to Tufts Dental School. I went off to UCLA for my residency. And then I moved back to Boston, and that practice that I loved so much, I came back as a prosthodontist. And I was teaching at Tufts University and kind of splitting my time with another practice as well. Since I was a dental hygienist, prevention is always it's part of my dental DNA. So I don't really know dentistry without, being kind of more comprehensive and having a preventive approach. So in 2010, we presented what we were doing as a practice to prevent dental caries to the ADA. And we were awarded the Adult Preventive Care Practice of the Year. And so really we did that just to sort of get a high five from the ADA and tell our patients that the ADA gave us their seal of approval on what we're doing. However, that sparked a whole new life for me that I really didn't intend on. I became a lecturer. I had people asking me to write about dental caries, magazines asking me to write. And so I did that. And basically, probably by 2015, I was asked to be an editorial director for this online component of dentistryIQ.com. And so I'm one of those people that refuses to say no out of fear. And also, I think I'm just not good at saying no anyway. So I took that role and I started learning this whole editorial side of dentistry, and I actually fell in love with it. And so I was able to gain experience with video and writing and all of those things. And so, like most things, there's a journey. And eventually I was offered the role as chief editor for Dental Economics magazine. And it was just such an honor. And I've been at it now for about 4 years, and I absolutely love it. And part of that role is video, obviously managing the magazine, the digital components of it, social media, and also or contributing to social media. I don't do all DE social media, and our podcast. So I do have a practice in Salem, Massachusetts, small private practice. It's me and 2 other associates. And we've got 4 hygienists here. And, again, comprehensive care is just really part of what I do. And so I think that we would be remiss if we didn't at least acknowledge sleep dentistry. And so we started off by trying to get the patient where they needed to go before we were able to obtain the training as a team. And whether it went to the orthodontist or to an ENT or to a sleep specialist, we would kind of have to punt the patient somewhere. And we really didn't have a lot of answers for them. And it really didn't change how I was practicing or how I was looking at patients. And so I felt getting the training, even though it's not the primary component of my practice, I feel like it's now part of what we do. And so it's absolutely something that's considered before I embark on a large or a small treatment plan.
That's a beautiful journey, but I like how you said, I don't want to say no out of fear, because I talk about that a lot, but fear, how embarrassing it sounds, it's a very moving factor. And I have a lot of fear inside of me. And when I look at the other successful people like yourself, and I'm thinking, what part of the drive that's actually deep inside is that fear? I totally can relate to that, but I find your journey so fascinating, with constant desire to move forward and forward and forward. And then how, it's all started with your father, want you to be independent. My mom also talk about that a lot, because I think it's very important for female. It's a very important feeling. It actually makes you stand tall and walk far. That idea, I think it's a modern time like that. So I totally can relate to your journey. But I want to ask you the questions what I get asked a lot, and especially you have a big educational component and you can evaluate the courses. What training programs or mentors had a bigger clinical impact on raising your confidence in the area of dental sleep medicine?
So one challenge I've encountered throughout my entire career is me going to a course by myself, whether it's a 1-day course or a 4-day hands-on course, coming back to practice, and between patients, before the day starts, at the end of the day, or if there's a cancellation, me sort of trying to tell my team what took place over the course of these 4 days. I feel like it's so frustrating, and it's not a great way to implement a new protocol. And so sometimes I still do it with composite courses or hands-on restorative courses. I'll come back and be like, I want these burrs and this is why. And eventually we sort of figure it out. But when it came to something as serious as sleep medicine, I felt that this wasn't something I can do successfully by myself. So I highly suggest that if you're going to take a sleep course, minimally take it with the ride or dies of your practice, or maybe the full-time people. What I ended up doing was I ended up bringing somebody in to my practice, and we had 2 full days of education and hands-on with our patients. And we took, I'll tell you more about the actual course, but we sort of left with light protocols, meaning there were some people that were more excited about it than others. Obviously, my office manager has to help figure out what's going on with billing. The doctor component of sleep medicine really doesn't have to be that complex. So obviously, I'm there for the occlusal registration, and I'm there for really, that's kind of it. I mean, I'm there to kind of help answer questions, but I've found that sleep medicine in my practice, and at least the way I was trained, was that this is very team led. And so if you don't educate the whole team, then you're not going to be able to implement this well, because we as dentists really don't have the time to provide the education and the screening and the onboarding and the showing them how to put on the sleep study test and all of these things. You really need the team to help.
No, that's beautiful. So if you would recommend a specific course, what, or the person, like who did you use?
I brought Dr. Erin Elliott into my practice. And so she brought her, a team member with her who was a billing specialist. And so I rented out one of those workspace areas so we could all just sit comfortably in a conference room together. So for the didactic portion of the education, we did that. And then we had to bring we had to kind of pre-screen some patients, and we brought some patients in to go home with some sleep tests. What was really interesting was she brought some sleep tests. We had a sleep test that we had purchased, and she said, oh, does anybody want to go home and do their own sleep test? So a bunch of us did. And what was remarkable is that if you look at my team, we all look like pretty healthy people. I would say, yes, they say, young, fit women tend to be a higher, demographic for sleep disorders. But it was interesting that every last one of us that took the sleep test home had an issue. And it was a different type of issue for a few of us, but everybody had an issue. And so that opened my eyes to think, gosh, this is a widespread problem for people, our patients, and just our communities at large. And I feel like, we see patients more than some physicians.
Oh.
And so if we can increase the awareness of it and maybe help them get the care that they need, I find there's a lot of patients that we screen and they really don't even qualify for a sleep device. They really need to go, maybe the direction of a CPAP first, because it's significant. And so I think if you think that you don't have the demographic in your practice, you probably would be really surprised.
Yeah, no, that's a very encouraging word, and like you kind of telling my script. I usually educate. Before this interview, I had a meeting with Neurobalance device, and she was so surprised what dentists are involved in sleep. And I said, people don't realize how much we actually see. We see so much, and it's just different type of relationship we have with our patients, what can help to maybe redirect this area fundamentally towards through the dental offices. But I'm going to ask you two challenging questions about dental sleep medicine, what I always get asked about medical billing. How you create that workflow and how your team support that process, like what exactly happened in your practice to help patients with the medical billing. Of course, we can say, oh, we are fee for service. That's fine too. Or if you're trying to help your patients through the medical billing process.
So we do help them with medical billing, but we are fee for service for the most part. So I don't participate in Medicare billing or anything like that. So there are some things right off the bat that we're just not participating providers for. Regarding medical billing, though, to keep it simple, because it is quite complex, we source it out. So I work with a company called Pristine Medical Billing, and they help us with any billing related concerns, or just even processing billing for our sleep devices to help our patients get any reimbursement that they can. So we try to keep it really simple. I don't have a huge practice. So for us, it was just sort of, this is something we wanted to do. We think it's really important. We think we can help our community, but we need to be able to implement systems that will sustain in our practice. And in some instances like this one, we had to source it out.
Absolutely, that's a great answer. But tell me, what about billing collaboration with the medical community? And also, it's also getting back to medical billing because a lot of medical doctors, they expect, us being involved with that. And, but basically, besides the even billing, I want your view how to build that strong collaboration with physicians, in coordinating care and all of that.
Sure. Well, we're certainly not shy about reaching out to our medical colleagues. The one thing that's nice is, I think, being in the greater Boston area, I think that we're used to interdisciplinary education. And I mean, we're teaching it in the dental schools. And so I don't think communication and collaboration is something that's unusual in our area. So many times, if we reach out to a physician, they will, that somebody from their office will get back to us, which is nice. So sometimes it's just a matter of my admin reaching out to their admin and, us kind of getting, some documentation. But another thing that's been really nice is we work, I work with a few specific ENTs, and some of them were referred to me by my orthodontist that I work with, or my surgeons that I work with, and I have their email address. And so this way I can communicate with them directly, hey, I'm sending you this patient, whatever. I can tell you that, as somebody who, has brought sleep medicine into the practice, I don't claim to be the best sleep medicine doctor on the planet. And for that reason, I feel that if I'm not sure that a sleep device is the right answer for the patient, I will have no problem reaching out to to my medical colleagues and getting their help and their guidance. These devices aren't cheap, and I don't want patients to be disappointed or frustrated if it doesn't work out for them. So I feel like if there's a question or something like that, just don't proceed until you get the answers that you need. In some instances, for some insurances, especially if the patients are kind of more on the severe side, they have to try a CPAP first. And if they can't tolerate the CPAP, then you can consider an occlusal device. So I feel like, that type of collaboration is really important.
Yeah, that's a beautiful answer. But now I want to talk about a little bit different area of your professional life as the editor-in-chief of Dental Economics. I know a lot of dentists want to, or not only dentists, want to publish in your magazine. And I was published in your magazine. I'm very proud on the article and how it's all come out on temporomandibular joint splints versus oral appliance, or just screening for sleep apnea in that case. So what make for you article to stand out, and how can dentists develop the content ideas? Because sometimes you look at the magazine, you want to publish for that magazine, but as the editor, what you can recommend to people who have a desire to be published?
A passion. I feel like a passion for a topic, or a point of view for a topic. That I think that that's something that's really important. This is a practice management magazine, but we do have other components to it. So every month there's a theme, And so if you contribute an article that's kind of pertinent to the theme, there's a higher likelihood your article will be published. There's also science and tech. There's practice. So that can be even clinical tips or practice management tips or team management, HR, the law. I mean, compliance. I mean, you name it. A lot can fall underneath the umbrella of practice. Also, money is a category within the magazine as well. And so there's no topics that are really off the table. But having a point of view is really interesting. I think that a lot of times it's peer-to-peer learning that is the most beneficial. And so if you have a system in your practice that's working really well, or if you bought a practice that wasn't really profitable and you turned it around and you have tips to share, or you're attracting all these amazing team members and people can't hire hygienists right now, and you have tips on culture or appreciation, or maybe you're a financial advisor and you've helped dental professionals retire early or plan properly for retirement so we can retire on our own terms. Or obviously there's a big push right now for DSOs and what that looks like in those partnerships. Some people like to write about their experiences. Many don't. So I think those that are willing to share experiences like that, I think are really beneficial. There's really no topic that's off the table. I would say if you're thinking that you would like to publish something, but you're not sure, send me an email and give me your idea. And because we also have specific editorial guidelines. So I had somebody send me an article, and we're looking for articles that are about, I don't know, like say 1,000 words. And if I get an article that's 8,000 words, we cannot publish it as is. And so then we're going to be going back and forth a bunch of times. So certainly worth, if you're interested, send me an email. I'll send you our guidelines, send me your ideas. Sometimes I could say, this is perfect. It's great for this month. I'll need it by this date. Or I also review articles on a rolling basis. So if it's just sort of something you're thinking of that you want to send to me at some point, it could land in the print magazine, or it could land on our website, or shared with our e-newsletters. Either way, we have a lot of people that read dental economics, thankfully. And so certainly your wisdom and your experience can get in front of a lot of colleagues.
So that's a wonderful answer. But tell me where the dentist or future contributor can read about theme of the month, or it's not published anywhere?
The team of the month, we don't, I don't know anything about that.
Okay. No, because you said we publish every month.
Oh, the theme. I'm sorry. The theme of the month.
Theme of the month.
You would have to email me, because that's something that that's not online or anything like that.
Got it.
That you would just have to email me. It's some planning that I do for the year.
And the last question I want to ask about you as a host of a Dentistry Unmasked. What inspired you to start the podcast, and how do you choose the guests and topics to keep it relevant?
Sure. So it's a collaboration between Dental Economics and DentistryIQ.com. So the chief editor for DentistryIQ.com is Dr. David Rice, one of my favorite people on the planet. And so when I was offered the opportunity to have a podcast with David, it was like a no-brainer. To spend time to do anything with him is awesome. So he's one of my best friends. So that was a hard yes right away. Absolutely. So what we wanted to do with our podcast was to, now think about it. You go to conferences, you go to courses. We all do this as dental professionals or medical professionals, but there's foundational learning that takes place during those courses. But then maybe you have lunch with your colleagues, or maybe you go and have a cocktail with your colleagues or whatever. And you start talking about like the real impact of the education that you've received. That's the kind of conversation we're trying to have with Dentistry Unmasked. Those real conversations. Sometimes there's 100% agreement in the conversations that we have. Other times there's a little bit of conflict that takes place. I mean, obviously friendly conflict, and respectful, but sometimes there's topics that are, a little controversial. And so we pick our guests based on relevant topics, what's going on in dentistry right now, what's changing in legislation in dentistry, clinical topics. So really, there's no topic that's off the table with us. So it's a lot of fun. It's a quick podcast. It's like a half an hour long, and I'd love for you guys to join us.
Yes. So thank you very much, Pamela. It was a wonderful conversation. I'm sure our listeners are going to learn a lot about that, and they can find you online, and your emails we're going to put underneath this interview, so people who want to write the articles, they can reach out to you or learn from you. They can, you have a website and website for dental economics. So thank you very much for your time and for the wisdom you share with us.
Thank you so much for having me. This was so much fun, and it was wonderful seeing you again.